Demographic cycle. What is your idea of demography? Any idea? What is demography? What is demography? What is demography? Any idea? What is? No, what is demography? What is demography? Why should we learn it in medicine? What idea is it? Why is demography and why do we have to learn in medicine? Huh? What is demography firstly? And why do we have to learn it in medicine? Nobody's got any idea. Can I put the demography? Achha, theek hai, I'll just move on. So demography is the study of the human population. Okay. And the trends of the population. Now once again, why do we need to study the human population? Bola? Including changes in populations, the composition and its distribution. Why is it important? Why is it important that we should know the study of the population? Why should we understand the study? Why should we study the population? Ki labh hobe? Population pode? Huh? Bolo? Why should we study the population? Can amra cancer sab niye production korle holo? Why should we study the population? Why so blank? Everybody is blank. Boi kholo na, boi bondo karo. Boi bondo karo. Why should we study the population? Nobody is saying. Why? For lot of things. For a government, studying a population is very important. Is the population of Arunachal Pradesh and West Bengal the same? Huh? Yes or no? No. Is the population of Tripura and West Bengal the same? Though they have the same language? Huh? Yes or no? Tripura te kyun ache kare? Huh? Is Tripura and West Bengal same population? So why is it different? What makes it different? And what is the importance of being different? Cheta bolo. Tripura has a Bengali speaking population. West Bengal also has a Bengali speaking population. But what is the difference? Why is it important to know the difference? Bolo. Bolto acha na? Huh? Population density. Okay, so population density, he said one important thing. So what happens after the population density? Huh? What happens after the population density? Center gives 200 crores to Tripura. If it gives 200 crores to West Bengal, what will happen? Kichu nahi. Because West Bengal's population is much more. Population density and the other things. So that's why it's very important to know the population, study of changes in population size, composition and distribution. So demo means people and graphy, as you know, is the measurement or the picture. So this this depends on the health status of the community, depends on the population. How much, like for example, your friend in Tripura, the population of Tripura, how many hospitals it needs, how many primary health centers it needs in a particular district, as compared to say West Bengal, how many are needed in a district. That is based on the population. So for that, planning of health services, like for example, how many health units we need, how to distribute them in the community. How to distribute them in the communities. For example, if all medical centers is centered around Calcutta, what about the districts? Where will the people in districts go? All the districts, for example, if everything is in the district headquarters, what will happen to the rest of the places? So everybody has to go to the district. So district will get overburdened. That's why how to distribute them to in the community in order to be accessible to a target population, what type of manpower is needed. Okay. Now, elements is the population can increase or decrease, and the composition, and the third one is the distribution, which area it is. Now, we all know that some areas the population is less dense, like if in the hilly areas population less, in general things. The urban areas it's more. So what is sources of demography? Sources of demography is basically census. We have not had one in the past 14 years because of, it was supposed to be held in 2021, but because of COVID it was not held. And then you have birth rate, death rate, and national sample survey registration, and vital events. Vital events means births and deaths. Okay. So this is the census is the biggest data on all this. demography, economic activity, literacy, education, housing, household, urbanization, fertility, mortality, how many scheduled castes, scheduled tribes are there, language, religion and migration. All this is there in census. So census, the problem is that it started once in 10 years, but when the census person comes to your house, he is supposed to come again. Again, he may not come. So he might randomly fill, but it's a very painstaking effort to fill this. It takes a lot of time to fill this data. Demographic, economic activity, literacy, education, housing, household, urbanization, fertility, mortality, scheduled caste tribes, religion, language. Okay, so what happens here basically is in the demographic process, fertility. What is fertility? What is fertility? Fertility manatake. What is fertility? What is fertility? Bola? What is fertility? What is fertility? Bola? You don't know what is fertility? Ability to? Okay, ability to reproduce. So certain communities, they have, one mother's got 5 children, another mother's got only 1 child. So fertility is one important thing. Second is mortality. Some people, they live for many years, many states, many countries. Japan and all, for example, 90-95 is not a big issue. But here, we have people who live that long, but generally it's less. Same thing with migration, marriage, age at marriage. That's a very important thing. Which also influences the fertility. Migration. Now, 20 years back, people never used to travel that much. But now people are going everywhere for jobs. Going to Mumbai, going to Delhi, going to Kolkata, going anywhere, going abroad, all these things. Social mobility also. Okay, it is from the lower middle class, somebody is trying to go to the higher middle class. He's buying a car, he's buying a luxury apartment, etc., etc. So, this is the population source of statistics we have told you. Census, national sample surveys, registration of vital events, ad hoc demographic studies. So, this is census, this is the actual picture of 2011 census happening. Okay. This is the enumerator, the enumerators. These two people are recording the whole thing. Okay. Sitting in the village and the others are watching. So, the data also has to be correct. So, it's not easy. They come to the village everywhere and they do it. Usually done by the teachers, educated people. Okay. So, now when we talk about demographic, there's something called demographic cycle. So, you have these stages in demographic cycle. First one is the high stationary. High stationary is high birth rate and high death rate. People are multiplying, there's no family planning process, but at the same time, there's high death rate also. So, India was in this process till 1921. That is the first stage. Second one is late expanding. Death rate is declining, birth rate remains unchanged. Most countries in South Asia and Africa. And the third one is late expanding, death rate declines further, birth rate tends to fall. But births exceed deaths. Therefore, we are still expanding and India is now in this phase. That is third phase of population demographics. Okay. Then fourth one is low birth rate, low death rate, population is stationary. Like industrialized countries, there is no migration, not much migration, and the birth rate is less, death rate is also less. Countries like Austria, Sweden, Denmark, and decline, population decline. Birth rate is lower than death rate. So, countries like Germany. Now, the problem with this is that many countries, they change their norms occasionally. Like for example, Singapore. Singapore is a small country, very small, it's an island state actually. They introduce a one-child norm. So, if you have more than one child, that child will not get a lot of benefits. Same thing, China, they introduce a two-child norm. If you have a third child, you will not get any benefit. Not only a delivery will not be done there, the child will almost cease to be a Chinese citizen. So, when people were having the third child, they would go to Hong Kong for delivery because here, they will not get paid, they will have to pay for delivery, they will not get any benefits, nothing. But now, what has happened is, Singapore has, after the population declined, they said we want more children. Now they're saying we want more children, let people have more children because we won't have a growing population. So, this is the world population trends, ever increasing. expected to reach 8 billion in 2025. We already reached that, I think. Most populous countries of the world, China and India, you can see that in the picture. And regarding birth rate and death rate, declining birth rate, what is the reason? Changes in attitude towards growth, spread of education. Previously, we had the family, joint family. So people didn't have much work. 1 child, 2 child, 3 child. Now it's not. People have become more educated. So they are adopting family planning measures. And there's a change in marriage patterns also. People are getting married at a slightly older age. Previously, 20, 21, people used to get married. But now, even girls are getting married around 28, 29, etc. Declining death rate, what is the reason? There's an improvement in maternal and child health care services, successful immunization, diarrhea and respiratory disease control program, and reduction in infant and child mortality. So these are the things which actually brought about a reduction in the declining death rate. So the birth rate is declined, death rate is also declined. So this is the basically demographics. We've talked about this. 5 demographic process: fertility, mortality, marriage, migration, social mobility. This also we talked about it. Population census, NSSO, registration of vital events, ad hoc demographic studies, etc. So these are the 5 stages of demographic cycle, often asked in exam. First stage, high stationary. Second stage, early expanding. Third stage, late expanding. Fourth stage, low stationary. Fifth stage, declining. So just to give it in a review, in the high stationary, the birth rate is high, death rate is also high. But the demographic gap, that is the gap between the birth rate and the death rate, is narrow. In early expanding, the birth rate is unchanged, but the death rate begins to fall. So after 1921, the death rate began to fall. And late expanding, the birth rate falls and the death rate even falls further. So this is then the demographic gap decreasing, and then low stationary, both drop, it becomes narrow, and the decline, when it's declining, it's a complete reversal. The birth rate is lower than the death rate, and the death rate is obviously higher than the birth rate. Okay. So here what happens is, the population composition is mainly young population in all this, but here in the lower stationary, it's a mixed population. So I'll just go to this. Just how the birth rate and in the early expanding what happens, and we'll not go much into this slide. Now there are certain things terms which you should remember. Fertility, I asked this question, what is the fertility? Fertility is the ability, is basically births. Number of live births during the year divided by the mid-year population into 1,000. Number of live births in a year divided by mid-year population into 1,000. So suppose the mid-year population of a town is 5 lakhs and there are 50 live births. What is the birth rate? The mid-year population is 5 lakhs and the 50 births are there. What is the birth rate? 50 by? Yeah, 50 divided by 5 lakhs into 1,000. That is the birth rate. Second is the mortality rate. Number of deaths by mid-year population. So first is number of births by mid-year population. Second one, number of deaths by mid-year population. Same thing. Then migration. Migration is movement of person from one place to another for jobs or whatever. So this we also talked about, declining birth rate and things like that. Now growth rate. Growth rate is accrued birth rate minus death rate is the growth rate. Now obviously if the birth rate is 50 and the death rate is 30, the accrued growth rate will be 20. Okay. So if it is on the basis of annual growth rate, we can say in what time the population doubles. Okay. And if the growth rate is more than 2%, it means an explosive growth. Okay. The population will double in less than 35 years. Crude birth, now look at this. Crude birth rate is 21.6 per 1,000 population. Crude death rate is 7. So annual growth rate is crude birth rate minus 7, that's 14.6 or 1.56. So this is exclusive migration, mind you. Exclusive migration. So if you take the migrant population means not from other countries necessarily, but from the normal situation. A town has got so much population. In 10 years back, Now this is population. So that is a normal thing. Okay. That's called the annual growth rate. So this is what I was talking about. 1920 was the cutoff year. The great divide they say. After this, there was a rapid, the slow growth rate prior to 1921 due to natural checks like famines, epidemics, better nutrition, improved healthcare, and then there's a decline after that. Okay. So these are some important definitions: crude birth rate, crude death rate, general fertility rate, general marital fertility rate, age-specific fertility rate, total fertility rate, and net reproduction rate. Now, first is we talked about crude birth rate, number of births per 1,000 population, crude death rate, number of deaths per 1,000 population, general fertility rate, number of live births per 1,000 women. Remember, not general population, but 1,000 women of childbearing age, 15 to 44. That is the general fertility rate. General marital fertility rate is number of live births per 1,000 women in reproductive age in a given year. Okay. Then age specific, number of live births in any specified age group. Total fertility rate is number of children a woman would have if she were to pass her reproductive years bearing children at same rates as the women now in each group. It gives the approximate magnitude of completed family size. And net reproduction rate is number of daughters a newborn girl will bear during a lifetime, assuming fixed age specific and mortality rate. It's a demographic NRR 1, that is net reproductive rate 1 means the two-child norm. So previously during family planning they used to say hum do hamare do, the two-child norm. Okay. So the last one is net reproduction rate is number of daughters a newborn girl will bear during a lifetime, assuming fixed age specific fertility and mortality rates. So this is demographic trends in India. So UP is the most populous state, followed by Maharashtra and Bihar. And Bihar is 16. UP's got very high. Then Bihar 16.46, Maharashtra 9.29, and Bihar 8.58. So the important thing is that it helps us for planning. How does it help us in planning? By now you've got an idea of what is demography. How does it help in planning our health needs? How does it help in planning our health needs? Bola. Huh? Suppose you have a population of an area is a population of 10 lakhs. Another area is a population of 3 lakhs. You want to build a hospital. Neither of them have doctors. Neither of them have hospitals. এক জায়গায় 10 লাখ আছে পপুলেশন আছে, এক জায়গায় 3 লাখ পপুলেশন আছে। কোথায় করবে, কিভাবে করবে? হ্যাঁ কি বলো 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 10 lakhs का यहाँ करना, okay, very good. 10 lakhs, you ideally should do it when 10 lakhs. So for that we have to, that is what where is the more population, we should try for that. Now again 10 lakhs hospital, she said 10 lakh population वहाँ करना, okay, very good. Now you need a lot of staff for that. 3 lakh population, maybe you can do with 3 or 4 staff. 10 lakh you need more people. That is the importance. The population you should know, then only you can plan the services, whether it is a hospital, whether it's a primary health center or anything else. Okay. That's why it's very important. Now comes the age pyramid. Age pyramid tells us what is the population in that particular thing. Okay, this is, I'll show you better in the next one. This is so population pyramids tell us actually what one second. Okay, before I move to the next part, this slide you won't be able to understand this properly right now. This pyramid, just look at this pyramid, okay. Early expanding means wide base. Wide base of pyramid means lot of young children. তোমার এটা দেখলে তো এটা স্লাইড দেখতে বুঝতে পারবে না। Okay. Then there's another term called sex ratio. Number of females per 1,000 males. Now, ideally, what it should be? Female male ratio, what should it be normally? Ideally, ki hora uchit. Huh? What should be the ideal normal female male ratio? Without any problems? Ki hora uchit. Well, think 1:1, right? For one male, there should be one female. But here, what is happening is that we are having. তোমরা দেখতে পাচ্ছ এখানে এখান থেকে দেখতে পাচ্ছ? Can you see or you can't see? বলো তোমরা দেখতে পাচ্ছ কি দেখতে পাচ্ছ না? No, if you can't see, I'll put another better slide. I don't think I can. This is the population we just showed you. I just showed you slide. Improvement in maternal and child health services. দেখতে পাচ্ছ পিছন থেকে? Can you see? Last bench. দেখতে পাচ্ছ? Can you see that? আচ্ছা. So this is the growth rate. Now age pyramid. We have talked about age pyramid, which is important. A specific type of graph showing the age and sex. In developing countries, it's broad-based. In developed countries, it's a bulge at the middle. It was France and India. What can you say about this France and India? France is on the left side, India is on the right side. What can you, general impression take? What is the difference between these two pyramids? 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 Bolo? Your visual impression, bolo. Aki? Na alada. Alada ki ache? What is the difference between these two pyramids? Bolo. What can you see? Left side is males, right side females. What can you see? That's the age also given there. Tumra ki buchcho? What is the interpretation? কি বেশি বলো? ইন্ডিয়াতে বার্থ রেট বেশি আছে, ঠিক আছে। তারপর
মানে ইয়াং পপুলেশন বেশি আছে।
ইয়াং পপুলেশন বেশি আছে আর নিচে ব্রড বেসড আছে। ওকে, নিচে ব্রড বেসড আছে and here it is not like that. France is not like that. Now if you look at the male and female population, it's almost same. So just now what I told you is this is male and female. Now ekhane jeta hocche, the developed countries bulge at the middle. Bulge at the middle means, what does it mean? This bulge, what does it mean? এই বাল্জের মানেটা কি হচ্ছে? মানেটা কি হচ্ছে? More people are this age are working, but we have a larger population here which were not working, and at the top we have an older age population who are not working. এখানে আমাদের we don't have that much like developed countries. Okay, so what is happening is, depending on what we have is dependence. The small children are dependent on us. Our parents who don't have any source of income, they are dependent on us. So number of females per 1,000 males, and there's the reason why I told you is that sex ratio should be equal, but it's not the same. There's a preference for male child, particularly in places like Haryana and other places. Always male child everybody gives a party. Female child, well, it's a different story altogether. And that's why sex ratio in India is adverse to women. Now dependency ratio, persons over 65 years and children below 15 years are economically dependent on productive age group. Right? A person above 65 years, you don't expect him to work. Or a child below 15 years, somebody has to pay the money, somebody has to pay the school fees. So you have what is called a young age dependency ratio or old age dependency ratio. So this is again a picture of a graphical picture, pie chart, urban, rural, and male, female, etc. So total dependency ratio is 0 to 14 children plus above 65 population divided by population of 16 to 65. That is the working population into 100. Now suppose in a field day, how many of you have gone to the field visit? Hatatolo field visit presentation karagara koreche. In that you must have seen that a family te ekta bachcha ache, ekta বাবা মা আছে আর একটা দাদু আছে। সো একটা বাচ্চার দাদু হচ্ছে 1 + 1 divided by বাবা মা divided by population of 1664 into 100. That is called dependency ratio. Demographic bonuses when dependency ratio declines because of decline in fertility. Demographic burden, increase in total dependency ratio during any period of time, mostly caused by old age dependency ratio. Again, you want people to live, but at the same time, they are sick, they are bedridden, they are suffering of stroke, they are suffering from something else. So that is happening. So next is density of population. Ke bollo Tripura lok kothay gelo? Density of population. Ratio between total population and surface area. Number of persons living per square kilometer. Now this is increasing in India continuously. Whether it's in Tripura, West Bengal or Tamil Nadu, Kerala, wherever, the population density is increasing a lot. Now if you look at the population density map, there's some time back. So our side is pretty dense. West Bengal is quite dense. This side is relatively Chhattisgarh, Maharashtra, Madhya Pradesh, slightly, it's not that dense. Okay. This is from the, okay, and maximum density is near New Delhi side, NCR side, okay. Arunachal, Arunachal kichu nahi. Mizoram is hardly thing. Then urbanization. Now, what is meaning of urban means? Going to a city or town. Obviously, why do people go? Why do people go to cities? Income. So, grama income hoy na. In grama income kom hoy. Acha, very good. है? No, तो नाम क्या बोला? No. Deepshika is saying that grama income kom hoy. ठीक की भूल. ঠিক কি ভুল? ঠিক, আচ্ছা। তো শহরে ইনকাম বেশি, ভেরি গুড। শহরে খরচা বেশি, তাহলে লাভটা কি হলো? শহরে গিয়ে তোমরা মলে যাচ্ছ, ম্যাকডোনাল্ডসে যাচ্ছ, এই যাচ্ছ, সেই যাচ্ছ, অ্যাট দ্য এন্ড অফ ডে পয়সা কোথায়? ও যা পয়সা আছে খরচা করে দিচ্ছে, গ্রামে পয়সা বাঁচাতে পারবে। ওকে, সো দিস ইজ জাস্ট আ জেনারেল স্টেটমেন্ট। দীপশিকা মে বি রাইট, মে নট বি রাইট, আই এম নট সিং, বাট দিস ইজ সবাই যায় শহরের দিকে, শি ইজ রাইট, ইন সার্চ অফ জবস, better lifestyle, better health facilities, etc. At the end of the day, কিন্তু the কতটা savings আছে সেটা it's an open question. ঠিক আছে? So any places with having 5,000 or more inhabitants and percentage of population residing in urban areas increase dramatically, and you have mega cities also. Okay. So this is urban and rural what we have. ये আছে। এখন urban দেখতে চাও, দেখো urban কোথায় আছে বলো? হ্যাঁ, মুম্বাই। এটা আরবান ভালো লাগছে? আরবান ভালো লাগছে? ডু ইউ লাইক আরবান? ডু ইউ লাইক দিস আরবান পিকচার? ডু ইউ লাইক দিস আরবান পিকচার? কোথায় এটা? কোথায়? Bombay. You are working like this in Bombay. You're catching the morning train, going to office or going to hospital, all for money. হ্যাঁ, ये Bombay मेरी जान। ঠিক আছে? মানে কোথায় উঠছে, কোথায় নামছে বোঝা যাচ্ছে। So then comes the family size, I told you. Total number of children was born, and completed family size, total number of children a woman is born during her reproductive age, 15 to 45 years. Total fertility rate is approximate magnitude of completely family size. Duration of marriage depends on duration of marriage, education of couple, number of living births, living children, preference for male child, decide family size. And the family planning program, they say, they want to have a 2-child norm with a net reproduction rate of 1. We will not go into family planning because it's a separate class by itself, but there are certain other things which you should know. Life expectancy. Now, if you look at the old pictures of even of film stars and all, or some old movies, you'll find people very thin, look generally malnourished, etc. But now you see more muscular, more smart, more this. A lot of things have increased. One of the reasons is the life expectancy. Because of the various food we are getting and various improvements. Not only food, not only the artificial food, even the agriculture has improved. So the life expectancy increased. So that's why we are having because life expectancy is increasing, what is the problem? What is the problem? Life expectancy badle for India? What is the problem? Key problem hote pare? পপুলেশন বেড়ে যাবে, আর কি হবে তোমার? লাইফ এক্সপেক্টেন্সি বাড়ছে, পপুলেশন বাড়ছে, কি হোয়াট ইজ দ্য প্রবলেম? ওটাতে কি প্রবলেম হতে পারে? হ্যাঁ হ্যাঁ ইয়েস বলো। Yes, old population. মানে somebody who's 80 years, 85 years, he's got so many other ailments. দেখতে পাচ্ছে না, শুনতে পাচ্ছে না, bedridden, hand and but his life expectancy is alive. But he needs 15 medicines. He needs a home nurse. He needs caretaker. He needs wheelchair. All these things. That is one of the things of having a increased life expectancy. Fertility is actually, we've talked about fertility. We won't talk about that. And again, এখানে fertility সম্বন্ধে we have this fertility rate. Bengal is somewhere in the middle. Now, age at marriage, duration of married life, spacing of children, education, all these are important factors in demography. Okay. So, births are more common in the first few years of life, married life, and that's the time when family planning effort should be considered. Spacing of children. Spacing means দুটো বাচ্চার মধ্যে গ্যাপটা কত? Okay. And education. Inverse association between fertility and education. More you get educated, the less there will be less children, etc. in the family. Then again, economic status, caste and religion. Also, there are certain things like some communities have higher fertility, and well-fed societies have low fertility. Family plan. These are all other factors. Now, this is a real picture taken by me in Pakur, in Jharkhand. Okay. আমরা একটা পালস পোলিও প্রোগ্রাম আমরা গিয়েছিলাম ওখানে। সো দিস ইজ আ পিকচার। আই ডোন্ট নো কার কার বাচ্চা আমি জানি না, বাট একটা বাড়িতে এত বাচ্চা ছিল। ওকে, এটা আর একটা আমার কলিগ, শি ইজ লুকিং এট দ্য ফিঙ্গার মার্কিংস ইন পাকুর। এত বাচ্চা আছে ওখানে, হ্যাঁ, ইন পাকুর, ঝাড়খণ্ড। পাকুর ইজ জাস্ট ক্লোজ বাই 2 hours from here. হ্যাঁ, সো ব্যাপারটা হচ্ছে এটা so many children over here. It's very difficult to find out কে polio খেয়েছে কিনা, but my colleague was looking at it. So and car bacha, that's another thing. Same thing, I was also doing it in Pakur many years back. The problem is that so many children are there and all of them look alike. One bacha ke wo acha. So this is the class on family, on demography, but I just thought let's add this slide. So family planning, we won't talk about that. Yeah, that's all from my side. So the purpose of demography is basically what are the sources of the population, that is, for example, census, vital statistics. Vital statistics is birth rate and death rate. Then your national sample survey. Then you have the pyramid. Okay, the demographic pyramid. What is important in demographic pyramid is we have the difference between developing countries and developed countries is that we have a broad base. We have a large dependent population, and at the top also we have a elderly population. In the middle we have narrow. On the other hand, developed countries, they have a rounded middle, which means the working population is high. Okay, that's a major problem. And the various stages of a demographic cycle, early stage, late expanding, late expanding, all that you should know. Then you should also know the factors that are important in demographics. Like, for example, fertility is the most important thing. Then your migration, literacy, etc. All these are important factors in demography. Why is demography important? Demography is important because it gives you an idea of what is to be planned, how is it to be planned, how do you plan your further things. Okay,